Hello Bell Squad fam. In this video I'm going to my 20-week ultrasound scan to check if my baby is developing properly, and they also check for like genetic disorder markers such as trisomy 18 and like for Down syndrome and stuff like that, and of course also the fun part, just confirming the baby's gender. I already know that it's a boy from our 14-week ultrasound scan, elective one, but it's always fun to nice to just get that confirmation, just showing you that it is right, you know, the first one, since it's so early on in the development at 14 weeks. I'm excited. I'm about to go do the ultrasound for baby Jax. So we're gonna go check him out and see how he's doing and do the, it's the medical ultrasound. So basically just doing measurements and stuff and just making sure he's growing properly and everything like that. So that is what we're gonna go check out right now. So I'm super excited. I'm excited to see him again, moving around, and hoping to be more connected and get that bond more with him, since I'll be able to actually see him in there. And he is kind of moving around. I feel the kicks a little bit more, but he's still really, it's still like really light kicks. It's not very strong. So I am excited to actually see him in there moving around, and hopefully we'll get some cute shots of him maybe sucking his thumb or something, or yawning or something cute. So I'm excited, about to go in right now. Okay, so I have to wear this mask. Not looking forward to it. I cannot breathe at all in these things. They're so miserable. So I'm gonna have to put this in so I can go into my doctor's appointment, because I have to be there in my appointment's at 1. It's 12:44. So let's get this thing on. All right, got my mask on now that I can't breathe, and I'm about to go in right now. Oh, I'm so stuffy and hot already. All right, gotta get my paperwork. All right, let's go in.
How are you going?
I've been okay, yeah.
No complaints or concerns?
I mean, just the normal, you know, pregnancy stuff, symptoms and things like that, but, you know.
Any pain?
No.
Okay. Baby moving?
Yeah, I'm starting to feel kicks. I started to feel kicks about 18 weeks, so.
Okay.
They're really light, they're not very strong.
But moving around.
But I'm feeling it, yeah, here and there.
Okay, good.
Off for a minute. I cannot breathe there. It is so hot. It's hot today, and wearing this is even more exhausting, even hotter. So just waiting for the ultrasound tech to come in so we can see baby. Unfortunately, at this scan, they did not allow me to record everything due to legalities or something. They said that I was not allowed to record. So kind of disappointing, especially too since, sorry, I get really, really out of breath. Like shortness of breath was really bad with this pregnancy. It's like really hard for me to breathe and talking just gets me winded really bad. So if I do that a lot, I apologize, just the pregnancy. But so I was pretty disappointed that I wasn't able to have my husband with me, obviously, because, you know, it's a big deal. It's his baby too. And also want him there for support. You know, it's always nice to have your partner there for support. But due to the whole COVID thing, they didn't allow him to come in. So it was just me. And I was hoping that I could do, you know, video of it, record it. And they said that that was not allowed, but I could do like FaceTime or something like that. And unfortunately, since my husband's phone is an Android and mine is an iPhone, we've tried this before. We tried this at my first doctor's appointment. And our phones like would not connect. There was like bad connection. Plus it's like the hospital. So I don't think there's like very good connection anyways to begin with. And we could not get them to connect. How many times I've like tried, it was just not working. So that wasn't really an option for us either there. Really exhausting laying there. It was like over an hour. I was very uncomfortable and it was really hard for me to breathe. It was really hot that day. It was like probably close to 100 degrees. And I was just really uncomfortable laying there in this, you know, I have to stay in this certain position, obviously, because she's checking around, you know, the baby on my belly. And in the beginning, they were like requiring me to wear a mask. And I can't wear them for long periods of times because it makes me sick. It makes me dizzy. I feel like I'm about to fall over and pass out. And so I told the lady there, because she asked me when I got in for my appointment, and my appointment was supposed to be like an hour long, you know, ultrasound, checking all those, make sure everything's okay. So I was like, there's no way. I told her there's no way I'm going to be able to wear a mask for like an hour straight plus or whatever, however long it's going to take you, but at least an hour to do this scan. So I told her I'm not going to be able to wear it. Like I'm going to feel sick, and I've, you know, tried this before and it makes me sick. And so she was actually okay with it, and she just said, okay, well, we obviously don't want you getting, you know, passing out, and that's not good and stuff. So, and they should, you know, allow me to take the mask off because it's, you know, due to medical, they said, condition in our county that you're not required to wear the mask. So that was fine. I would have had to like walk up and leave if she would have made me wear it the whole time. Because I was just feeling sick, as is even when I took down the mask. Just laying in that position was really uncomfortable. It was really hot, and I already felt sick. So I definitely need to take that mask off. I could breathe so much better without this mask on. So I wasn't able to record any of the actual ultrasound because they said that, I guess it's a legal thing, so I was not allowed to record anything. So I wasn't able to get that, unfortunately. But I did get to confirm that it actually is a boy still. So that is one confirmation I got. So after the scan was all done, I mean, it took forever. It was like over an hour. And then also they got pretty much all the pictures, she said, but they just didn't get, I think it was my, I don't know, the umbilical cord or something. I forget exactly what it was, but there was just some things, a couple more pictures that they need to get. So they weren't able to get everything, but they pretty much got the majority of it. So then the sonographer comes in. And I wasn't expecting to like have it so fast because I remember my previous pregnancies, they usually would do the scan and then like call you later or tell you later with the results. But this time she said, okay, the sonographer is going to be in shortly and go over, you know, with you with the results. The sonographer comes in And then, so she tells me that everything looked really great. Everything was developing properly. There was like no evidence at all for Down syndrome. I guess they look for certain markers, and there was no evidence of that. And because of my age, maternal age of being 39, supposedly the rate is higher for having a Down syndrome child. So, you know, they were checking for that. But she said nothing showed at all. And because I had a normal scan, she said it dropped my percentage rate by 40%, the chances that I would end up having a Down syndrome baby. So obviously there's no way to know for sure, like 100% with the ultrasound itself. They have to actually do the genetic testing, which I declined to do at the 10-week because my insurance would not cover it, and it was going to be like over $1,000. So I wasn't able to afford to pay for that. And another reason why I decided not to do that, the genetic testing, is because even those are not 100%. So even if you do the blood test at 10 weeks, it's not 100% accurate. So if you could get a false positive. So if I did get like a false positive at that test, the only way to know for sure would be more testing, which is the amniocentesis, which is that like long needle they stick in your belly. But that could cause more problems, and it can end up a miscarriage and other issues. So I just did not feel comfortable doing that, and I wasn't going to do that. So I kind of thought, well, you know, if I'm not going to do that, what's the point of doing the genetic testing if I'm not going to for sure find out with the amniocentesis if something does come up? So we declined that. And then she did offer me again. She said there's more genetic testing again. I believe it was like another blood test. And then she was saying, again, you know, everything leads back to amniocentesis. If there was like some sort of concern in the blood test, genetic blood test, and then we would have to for sure confirm it in the amniocentesis. So again, I declined, and she said that honestly, you know, it looks fine. And since you have no prior history of any complications for any of your births, I mean, all of my children were born to term. Everybody was, you know, healthy when they were born. Everything was fine. No, there was no genetic issues at all. So she said, yeah, that's fine if you want to decline it. And I don't think there's really much for you to worry about on this. But of course, we don't know for 100% until obviously the baby's born, unless I did some of those testing. So, but I was very relieved to hear that everything was going good. Everything is fine. I'm, you know, healthy as I can be during this pregnancy. And he is developing so everything was good with him. Everything was fine medically. And then for me, because I've had 4 prior C-sections, the concern always is placenta previa or accreta, either one of those. I can't remember what the difference is, but so there's always concern about that. It's basically when the placenta attaches to the scar tissue from all the C-sections. And, you know, that could be dangerous. So they were checking for that. And she said at the time, there was no evidence of that. I do have an anterior placenta. So that's the position of it, it's anterior, meaning in the front. So she said that they do want to keep an eye on that because things can change, obviously, as time goes on. So I am scheduled again for another ultrasound in, I believe, September to come back in to check baby, I guess get a couple more pictures of baby, and then also to check my umbilical or to check the placenta to make sure to see what position. And right now she said his head's up here. So his head's up here, and, you know, rest legs are down at the bottom. And she said, obviously that's not for concern right now because I'm still only 5 months pregnant. So, you know, he does have time to turn and come out properly. I think that's called breech, I believe, when the feet are at the bottom instead of the head. But she said that's not for concern right now, obviously, because it's still pretty early in my pregnancy. So there was that. And then I believe that was like pretty much it. I mean, everything really went well and good to hear. And there's no concerns, you know, at all right now. And I'm not considered any high risk or anything like that. So everything so far is going really well. Okay, so I just got done with my appointment. That took forever. I was I was in there for like over an hour. She was just trying to get pictures of the baby, and the baby was not well, he was cooperating, but not all the way. So we didn't get every shot, so I have to come back in 8 more weeks to check that out.
Oh, nice. I can. Good.
It's you remember Texas Best Movers?
This is the update for my 20-week ultrasound anatomy scan. And right now I am 21 weeks today. So it's showing right here, I have this little app thing that shows me like, you know, what, how far I am along and all that. So I have this little app. And it shows that I am 153 days in. I'm at week 21 and I'm in my 2nd trimester. So I'm so excited to get into my 3rd trimester. I am, but I'm not. Like, I want to be in my 3rd trimester because I just want to be towards the end, because I feel like this pregnancy is taking forever. But the flip side to that is it's the worst, you know, when you're in the 3rd trimester, because obviously you're the most uncomfortable, you're the biggest, you're going to get bigger, and it's going to get harder, not easier on my body. So there's like, I'm really excited. I want to be, you know, in that trimester. And then again, I don't, because they call the 2nd trimester like the honeymoon phase. And so we're this like, you know, you're the most comfortable with your stomach size and all that, which, you know, I am right now. Like, it's not horribly uncomfortable. In the 1st trimester, actually, it was so uncomfortable. My belly just felt huge. It felt like right now. And so I'm happy to report that like it didn't get any bigger. Like, I thought it was going to be like humongous right now because of how big I already was in my 1st trimester. But now that I look back to it and think about it, a lot of that I think was due to bloating. And just like when I was eating a lot, because that has definitely gone down now. I do not like eat as much as I did before. Before I would like be eating all day long because I had to, because I would be so nauseous all the time, and the only thing that would like help it was to like constantly eat. So then I think that was the problem, just like bloating and then just constant food. And already like my stomach, when I eat, it gets really big afterwards. Like, I feel like I have another baby in there. It's like huge. I mean, obviously if I have small meals or like healthier things, snacking on like salads or fruits or vegetables or something, I don't feel like that. But if I have like a heavy meal, then I'm like feeling humongous, and it definitely pushes out. And I could definitely tell a difference with before eating and after eating. You know, like my stomach gets really, not like a lot bigger, but it does get bigger. Like, it's noticeable. It's definitely noticeable to me that my stomach is bigger after a meal. So, but I feel a lot better now. Like, I feel less like huge and stuff. And it's just so crazy to think that in my 1st trimester, I felt bigger than I do now. And, you know, it's all due to that bloating and just eating constantly. And then now, like I said, I've slowed down. So that has been better. So definitely now that I'm like in my 5th month, I feel the best probably out of the whole time so far. And I'm hoping that, you know, I stay feeling good, or it gets better, because I still have times where I still feel like sick or nauseous or like headaches and things and stuff. So I still get that. I still feel like dizzy sometimes. But, you know, other than that, it's a lot better than the 1st trimester. The 1st trimester was so hard on me. It was awful. It was just really torturous. And I'm so glad I'm through that. So now we're off to, you know, getting close. I have like another, you know, month until I get into my 3rd trimester. And it's like, I can't wait for that. So that is it for my 20-week anatomy scan update. And thank you so much for joining me and watching it today. And I hope to see you guys in the next video. Please don't forget to subscribe to my channel so you can see more videos like this and follow along with my pregnancy journey. And also my son that has type 1 diabetes, and he is 6. And we also have his journey that we do a lot of vlogs on. So hope you enjoyed it. Thank you so much for joining. That notification bell next to the subscribe so you can get notified on my next video. Thanks. See you next time.